Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. While I'm shooting this film today, it's very, very hot outside. Talking about 105 degrees is going to go up, but they also have times when the temperature is low, below zero. No matter whether it's hot or cold, everything suffers. People often just think of people suffering, but as I look at plants, they suffer. As I look at birds, they suffer. As I look at stray dogs and cats, they suffer. The whole world suffers. Life suffers. We take it upon ourselves, however, to give our priorities to human beings, of course, most of the time. But there are wonderful organizations, however, that carry out wonderful things for stray animals and are doing things that are appropriate in watering plants and things like this. But it's all about life. It was Dr. Schweitzer who brought up the whole concept of reverence for life. Reverence for life. And he almost made a statement to say that even a virus is important. You might not think it's important, but a virus can get you sick, but a virus can get you well too. But a virus, the only thing he talked about was that a virus is only interested in reproducing itself. And if it has to take you on as part of its place of surviving, it will take you on. And you'll fight it off also, So it's life in general. And so basically, as we are here today talking about heat and all these kind of things, I have a wonderful doctor here, associate professor in family medicine, and does a whole lot of wonderful things outside of medicine to discuss just life in general of heat, cold, human beings, and we as physicians, and you as a person who should be concerned about folks who are in danger in one way or the other. Maybe just have a little discussion on those kind of things. So I want to welcome you, Dr. Sadowski.
Thank you. It's a pleasure to be here.
Thank you so much for being who you are in family practice. But before we get into our conversation, I'd like you to just give an idea of family practice today and how you see it, and why you are a family practitioner rather than an internist or a OBGYN, what have you.
Yeah, it's a good question. And family physicians are actually the doctors that are usually the first doctor that a patient encounters in the healthcare system,
right,
but is also defined as a doctor who can take care of 90% of the patient's problems.
Mm-hmm.
So for most patients, a family physician can handle their problem, take care of it, and it could be one-stop shopping.
Right.
Of course, the family physician can also refer you to physicians that you may need to see for more specialized problems.
Right.
But family practice is really a large specialty across the country.
Right.
There are probably about 140,000 family physicians out of the total 700,000 physicians
Just
in the United States. So there are a lot of us around.
Sure.
And we're actually carrying the burden of seeing patients for a majority of their problems.
Right.
So we're a very important specialty.
Right. Well, it's really interesting. When I meet up with medical students in their first year, to get into medical school, you have to do a paper why you want to become a doctor.
Right.
And so at the end of their 4 years, and out of maybe 200 students, 5 want to become family practitioners. And you ask them, well, why don't you want to go into family practice? Well, I like to do this kind of thing and that kind of thing. But they didn't mention that on the statement why they want to become a physician,
Right.
So I think that we're getting a lot of young people into medicine, maybe camouflaging really what they really want to get out of medicine, but write perfect compositions of who they should be or what they want to be.
Right. I think a lot of students do that, and it's partly because family practice is really a philosophy of care.
Right.
There are no limitations to what a family physician can do.
Right.
If the family physician is appropriately trained,
Sure.
we can do skin biopsies, we can do colonoscopies, we can do upper endoscopies, we can do lots and lots of procedures.
Sure.
So family practice is really a very popular specialty
Right.
among the public, and it's a popular specialty among the government because it's a less expensive mode of care, because generally family physicians can accomplish 3 or 4 things during a visit,
Right.
where a cardiologist may accomplish only 1.
Well, that's very interesting because I had a friend who was a neuro-ophthalmologist, and of course that sounds very big and strong and very interesting, but all they have to do is really know 5 diseases, because by the time they get to the neuro-ophthalmologist, he has to be familiar with a limited amount of diseases, basically.
Right.
When you think of a family practitioner with books this thick, written on every year, coming out with new concepts of diet and this thing and that thing.
Sure, I say the same thing to medical students often, and I say, let's compare a family physician with a nephrologist. The nephrologist, every patient he sees, has failed kidneys.
Right, sure.
So he writes down the dialysis prescription, figures out where that's going to be done, and he sends the patient.
Sure.
And things get done kind of automatically.
Right, sure.
Whereas the family physician is sitting there never knowing for sure what their next patient is coming in with.
Right.
And I find that a fascinating challenge and very enjoyable.
It is.
Those of us who are in family practice also are doing a lot of the geriatrics around the country.
Sure.
Because there's not enough geriatricians.
Meaning
So-
what, the geriatrician? What's the meaning
the
of that?
geriatrician is the physicians who take care of older adults. They
Okay.
specialize in older adults.
fine.
There's not enough geriatricians. So older people are going to see family physicians. And I love that part of my practice.
Yeah, right.
I love talking to older adults, finding out a little bit about their environment, about
Yes.
their family, a little bit about their lives and their past history.
Oh, yeah.
And then trying to analyze what kind of medical problems they have and putting them in the context of their lives.
Right, Shirley.
So that I can treat their medical problems so that they can continue to have a productive and healthier life.
Right. Well, I practiced for over 40-some years, 44 years. In fact, I've been at Downstate 54 years when I came here as a medical student. So when I came here, they had on the medallion it said, "Let each become all that he is capable of being." And I took that very serious, becoming all you're capable of being while you're studying medicine. And I chose to not to specialize so much just in internal medicine or cardiology or neurology, but people. And so when I took my residency, instead of taking a full 3 years of just medicine or 4 years of just medicine, I took 6 months of medicine each year, and the other 6 months was broken up 2 months in subspecialties,
Right.
such as ENT, ophthalmology, rehabilitation medicine, dermatology, and things like this. So when I hit the ground running, when I graduated or got my residency, I was ready to look at everything on the patient rather than just one thing.
Right. Well, that makes you a generalist as an internist.
Right, surely.
And certainly there are a lot of internists who take care of patients as primary care clinicians.
Right.
But did you ever have a rotation in obstetrics?
You did not? No.
We did.
Yes, right.
Did you
sure.
ever have a rotation in gynecology?
Right, surely.
You know? So, there are a lot of differences. I mean, we also learn as family physicians about pediatrics, about caring for children,
surely.
about helping women with gynecologic problems.
Right.
And if we choose, we can do obstetrics also.
Right, surely.
So family physicians across the country are doing an amazing list of things in their offices.
Oh, yes.
And really trying to provide most of their patients with full care.
Full care,
so the
surely.
patients don't have to go to specialists.
Well, just like I said, when I took those things, those other 6 months and broke it up, I did go into gynecology and things like this.
Right.
And think myself, because I knew
Yes.
I knew these kind of, or dermatology or all the other things. And so, but I knew that I had to, for example, I remember so many people coming to my office with their, couldn't hear, and just by being on ear, nose, and throat, the first thing I thought of would be earwax,
Right.
you
There you
know.
go.
And I knew I had a syringe and a basin, and people used to walk out of my office thinking I was some kind of healer because he could hear, because I took a wad of wax out their ear that long.
Right.
you
So
know?
now they can hear.
Now they can
Yeah.
hear, you know.
Well, I'm finding as a family physician, actually, you probably would think we see most of our patients in the wintertime.
Yes, right.
Because you think everybody's getting viruses and flus
That's right,
and
sure.
everything. But in our practice here at Downstate, we are really overloaded during the summer months.
Oh, there we go.
And part of the reason for that is that people go on vacation, so they have time to go and see the doctor.
Right.
And other reasons for that is that people are drinking more liquids.
Right.
And the question is, what liquids are they drinking?
Okay.
I had a patient who came in to me yesterday who said to me that she loves to drink sweet teas. So she goes and she gets teas by the bottle in stores that have sugar in them.
Right.
And she's drinking about 4 to 6 glasses of these a day.
Yeah, right.
She's gained about 14 pounds, and she has all the symptoms of a new diabetic patient.
Isn't that same?
So, you know, the summer is kind of an interesting time for family practice.
Oh, yeah.
And we find that we're busier than we are during the winter.
Well, I tell you, when you have the temperatures raising above 100, certainly there's a lot of things people should consider to maybe prevent them from getting even to the doctor's office if they just want to stay comfortable. What are some of the things that you think with these seasons, like for hot seasons, for example, what should people be considered to?
Yeah, well, I think it depends on whether you can tolerate, you know, hotter weather, or you have a medical problem that makes hotter weather a little more difficult for you, or makes it more difficult for you to breathe. But what patients and people need to consider is to keep themselves well hydrated by drinking large amounts of liquids, and preferably liquids with electrolytes. Now, there
electrolytes meaning what?
Electrolytes like sodium and potassium and chloride. You know, kind of these sports drinks. Now, a lot of people, when they think of a drink like that, they think about Gatorade. And Gatorade tastes pretty good. It also tastes a little bit salty, and it actually has a fair amount of sodium in it, perhaps a little bit more than a drink that we'd like.
I see.
So I feel more strongly about trying to get patients to drink both water and tea. And if they don't like tea, unsweetened tea, of course, then they can put a small amount of juice, you know, in the tea. But we give patients very specific instructions about how much they should be drinking.
Yes.
Certainly somebody with congestive heart failure or who has renal disease shouldn't drink too much fluid,
That's right,
but should drink the right amount.
Yes, yes.
Somebody who's pretty healthy probably should drink between 10 and 12 glasses, you know, of liquids during the course of a day.
Right.
So that would be about 96 ounces. So that's almost 2 gallons, you know, of liquid during the course of a day. And many people don't do that. A lot of older adults, your thirst motivation is kind of diminished, so you don't drink enough liquids. So drinking liquids is important. Staying out of the heat, not going out in the heat for long periods of time. Trying to make sure that if you go out for a long period of time, you put on some suntan lotion, and we prefer a suntan lotion that has an SP factor of 30. The factor means their ability to block out the sun's rays. So during the summer, I think everybody should just take a little bit of suntan lotion and just sort of wipe it over their face and over their ears and over the back of their necks and even over their hands to try and protect them from getting a sunburn or from some other type of skin disease. So there are a lot of instructions that are important to give during the summer. Fortunately, a lot of patients come in, so we have a chance to give them these instructions.
Well, I know that you know, certainly the drinking of the fluids are certainly important. Even more so, the clothing that they wear, of course, or the type of clothing that they wear. You know, a lot of folks still wear the same kind of clothing that brings in the sun rather than reflect the sun and things like this. You know, but sometimes you just can't even think along lines like that. But the thing is that the sun is a wonderful brother. There's a whole thing written on called Brother Sun. The sun does a lot of good things for us, you know, and you don't. We need the sun. Let's put it that way. And so we have to, but we have to protect ourselves from the sun.
Certainly, the sun actually stimulates the production of vitamin D, which is very important for all of us to have strong bones, to put the calcium back into the bones. And there are a few studies that show that vitamin D may help to prevent falls. You know, it has some other value. So we're not 100% sure about vitamin D, but I think a little bit of sunlight is important for everybody. Unfortunately, our population around here, the darker your skin, the less sunlight you absorb and the less vitamin D you'll manufacture. As a matter of fact, it might be a good idea for your listeners when they go to their doctor the next time to just ask their doctor about their vitamin D levels and maybe checking it. You know, if you're a little bit below normal, it's not a big deal. And there are vitamin D supplemented foods and orange juice and other things that you can get. But if you're way under the normal, and you know, I think that puts you at risk for osteoporosis, which is porosity or thinning of the bones, puts you at risk for fractures, and I think it's an important thing to get enough vitamin D. Well,
you know, when you're talking about vitamin D, and especially in elderly people who may not sit out in the sun, often making house calls, or listen, just hospitals, the lighting in hospitals does not have the same radiance or reflection as a regular sun. So you'll find a person sitting in a hospital have a lot of vitamin D deficiency, and if they're in there for months, they're really in trouble. Of course, because even if you're sitting, years ago at the Kings County Hospital, they had a certain time of the day, they took the whole bed and pushed it out onto a porch.
Really?
Oh, yes.
That's very
and for people to get the sun, because they thought TB and sun would help the TB,
Right.
But they didn't realize they were given more than just that sun for that purpose. But when you talk about elderly people being in homes where nursing homes where they sit around and never get natural sun.
Sure.
I mean, think of the deficiency of vitamin D there.
Right. Well, there are some places for older adults when they're hospitalized or they're placed in an assisted living facility of some sort, they automatically prescribe, vitamin D and calcium.
Yes, right.
They give a reasonable level. But there are some that aren't.
Listen.
So people have to ask their doctors,
right, sure.
Do you think vitamin D is an issue for me? And hear what the doctor has to say.
Well, the thing is that when you write your orders on your sheet when a patient's admitted, very few people, especially doctors, will write anything other than a 1,500 calorie diet or 2,000 calorie diet. But they don't go down specifically to say, I want calcium, magnesium, I want zinc, I want this or that, and so forth, And when I had my patients in the hospital, elderly patients, every time the order would come down to the pharmacy, they would say, there's Dr. Deas' patients getting all this stuff.
Yeah, well, I guess most doctors feel that when they hospitalize a patient, they're hoping they can discharge the patient as rapidly as possible. You're hoping that that'll be the case.
But it's not.
But then as the patient strings out for a while, certainly the looking at these vitamins and minerals becomes more and more important.
Of course.
And I've noticed that even when you obtain a nutrition consult, and actually I think there's a nutrition consult on every patient in the hospital now, at least one.
Right.
It's sort of mandatory. The nutritionists are not really talking enough about vitamins and minerals.
That's right.
And they're talking mostly about calories, and they're talking about fiber, and things of that nature. And they're talking about special diets for people with specific illnesses.
Yes, right.
But what about the vitamins and the minerals?
You don't see it, And getting back to the warm weather again, other than the drinking plenty of fluids, suppose a person is really low now in these kind of things, what kind of symptoms would they usually have?
Well, I think that
if they become dehydrated,
early
dehydration.
If a person gets early dehydration or gets changes in their vitamins and mineral content during the summer, there are a number of different symptoms they could show. The most common one turns out to be fatigue. Some of them are minor or even major changes in your mental status.
Right.
There may be variations in your daily temperature. You may find that you have difficulty sleeping, and you may find that you have some nausea or some other kind of gastrointestinal problem.
Yes.
So I think that if you're not feeling yourself during the summer, and that feeling persists, for 24, 36, 48 hours, then I think it's important to go to the physician and see what's going on. And this is even more true for people who have diabetes or have renal disease or some other type of chronic medical problem. So don't be embarrassed. I mean, your doctor is willing to see you when you're just not feeling well.
Sure, of course. Well, when I used to make house calls, I used to enter a home where all the windows were shut. The temperature must have been sky high in there, and the patient was laid out, And I would have to, a lot of elderly people live alone, and they close the windows thinking they're blocking out the sun, and that room is higher than the temperature outside. And a lot of them are ill from just what you're just saying.
Right. You're absolutely right. And actually, I don't think people realize how easily you can get dehydrated.
That's right.
And I'm sure you, as I have, had a day where we're too busy to drink some water.
Oh, yeah.
And at the end of that day, you're really tired, you're really fatigued.
Surely.
Your mouth is very dry, and you feel really sluggish.
Oh, yes.
So, we as even healthy people have experienced dehydration. So it's something that people have to watch for, especially during the coming days.
And I think that a test that you could really do is if they just take their arm, for example, and pick the skin up. Now, I don't feel dehydrated, but you don't see the skin tinting.
Right.
If you pick up that skin like that and you find it go down very slow, then often that time that patient is dehydrated.
Right. So if the tent sort of remains,
yes, right,
then you're dehydrated.
Yes,
The other things you can do is you can look in your mouth.
Oh, sure.
And you can just see if the inside your mucosal membrane seems to be moist or not.
That's right.
If it feels a little dry or a lot dry,
right,
or you look at it and it looks dry, then you may be dehydrated also. And people who are dehydrated also turn out to lose a little bit of weight. And I happen to think it's a good idea for every older adult, and I think every adult, to have a scale at home.
Oh, yes.
And weigh themselves with some regularity. It doesn't have to be every day,
right,
but maybe twice a week, just so you can pick up weight losses or weight gains that might be representative of some kind of medical problem.
Sure. And I think doctors should also consider, see, they don't go make house calls generally, but they should ask specific things about the home and things like this. And of course, I think if they could write a prescription for an air conditioner, I think that would be more important than some of the water pills, because they are on diuretics, for example. They want to get the water out of them so they can breathe better, but at the same time they're losing magnesium and potassium and all those electrolytes. So here you have a pill that's removing things that you should be replacing anyhow, but even more so because of the dehydration.
Right, and we should mention, of course, that some of these minerals that you're talking about, like magnesium or an element like potassium, a deficiency of these can be very serious.
Oh, boy.
And these are responsible for normal cardiac function,
yes,
for normal renal function.
Yes, surely.
So if these minerals get out of whack, you could be in a lot of trouble.
Surely. With the child, say, playing baseball and all these different sports they're running around,
right?
What about these children playing baseball in the summertime and out there in the sun all day long, swinging that bat?
Well, fortunately, children have a little bit more flexibility because they're younger. However, they are subject to the exact same problems that we've been discussing for older adults. So we assume that any responsible team who's out there is going to have adequate water supplies,
right,
and adequate drink supplies that have some electrolytes in it.
All right.
And that way you can sort of balance the two and use them to keep the person well hydrated. Certainly if a coach sees one of the kids getting a little weak or slow or something like that, you got to take a look at it and maybe let them sit down in the shade for a little while.
Oh yeah, sure. And I think not to play the whole game through,
right.
because even their little uniforms, they all like little uniforms. Those uniforms are
they're kind of thick.
Thick,
kind of
yeah,
woolen. Yeah, a 5-inning game is very appropriate.
That's right. And so oftentimes in the emergency room, I've seen children come in almost comatose, and the temperature's 106, 107 degrees.
Right, and a cap also is very helpful, very important.
But in treating these children that become that dehydrated, to bring down that temperature, what is generally good if a patient doesn't have a hospital emergency room around, and they want to bring that temperature down?
Yeah, well, I mean, if you're out in the field,
yes,
then you can use some cool compresses.
Right, sure.
And then you can try and get the person to drink some liquids.
Right.
And you can even use some ice cubes that you can just simply place on the body. Not too much.
Right.
You don't want to make the person uncomfortable, but that's what you could do. If you have the facility to give some intravenous fluid,
right,
you can also give intravenous fluids also.
Well, in a practical way, I'm talking about young children at home when they get dehydrated like that. I often would have to tell the patient to mix a little alcohol with water, and I would tell them to get completely undressed. Just I'll bring down the temperature. And you take the alcohol and tepid water, not cold water, and do the whole body. Don't get it in their face or anything like that. And let the body lay out. Don't cover it up after you do it, because you want the vibration to cool down the body, But oftentimes they put the towels around it, but you don't do that.
Yeah, what you're pointing out is we really have the mechanisms to resolve this ourselves.
That's right,
we just have to be directed a little bit to do it.
That's right.
I mean, just like any other kind of animal, we can handle spreads of temperature.
Surely.
You just have to do the right thing.
Right, right. Well, I'll tell you, this discussion's gone 100 years into treatment and only in a half an hour. But we have to be on the ball to keep having you come back to discuss these other very pertinent things that people can do for themselves at home, what doctors they should choose for their family doctors, or how the family doctor should really relate to the patient as more than just a doctor, but as a friend and a concerned person and things like this. But with all your experience, Dr. Sadowski, in downstate here, how many years you been here now?
Well, actually, I started medical school here 40 years ago. So you have a little bit on me, but not too much.
Well, I guess 14 years extra is a lot when you think about it sometimes, because it doesn't seem like we've been here that long.
Right, I
you
agree.
know?
I
Especially,
agree.
I think
it's been so much fun.
Yeah, if you enjoy your work and you see people respond to your treatment, what could be greater in life than to become a physician? And I hope that folks looking at this, young people who want to become physicians, know that it's not just a place where you're going to make a lot of money, or that you're going to have security and things, because there's too many missionaries who are physicians and things like this. So I just want to thank you for coming with us today.
My pleasure.
And I hope we can continue our discussions on many of the other diseases that we treat each day.
That would be great.
And to you folks out there, family practice, family physician, there's a lot around. Make sure you choose the right one. Make sure you feel comfortable, and be sure that they're going to put their arm around you rather than their hand out a lot of times, But physicians folks who come into medicine, they are sincerely interested in helping. I haven't found one young person said, I just want to help people. I just wish we could keep that attitude going along as they go and study medicine. They continue to want to help people on all levels. I'm talking about not only the physical level, but the spiritual level, and all the things that make a person, keep them alive and well. So I'll see you the next time.